because like you said, you saw me on TikTok or Instagram or YouTube. I don't know where they see us, but
Yeah.
I always say you don't call the TikTok doctor first, right? You're calling him last. And you might not call him, till you're so desperate you don't know what to do anymore. Like, I'll call that guy. That's who I get, by the way. But what that means is everybody that is on my program has had back pain for a long time and tried everything before they finally call me, right? So my point is, the people you see on there in the case studies are people just like you. What we do is we help people that have not helped anywhere else.
Welcome to Bed, Back, and Beyond, sharing positive stories of recovery from serious back or neck injury. Your host is CK, a fellow champion who draws on her own experience with herniated disc surgery. Join her as she talks with others who have overcome the physical and emotional trauma of a painful injury, and discover for yourself how you can find hope and encouragement in recovery.
All right.
Hi, and welcome to Bed, Back, and Beyond. On today's episode, I am joined by Dr. Jeff. I'm very excited to have him on the show. He is the founder of High Performance Spine. He has a TikTok channel, which is where I found him, and he has a wealth of information to share about healing your herniated disc or back pain without surgery. Dr. Jeff, thank you so much for being on my podcast.
And thank you for having me. And I love the name Bed, Back, and Beyond.
Yes.
Is that because when you have back pain, you were laying in bed?
Exactly.
Wow.
And then the beyond is getting better, right?
Yeah, of course. Of course.
Yes.
Living happy, vibrant, pain-free, active life.
Exactly, which is what we want. Now, you have a personal story of back injury, correct?
I did. Do you want to hear the whole story? Because it's a long story, but I'll tell you.
Yeah.
It's important for everybody to understand why we do what we do. Because what we do is, I don't want to say it's different, but it's not traditional. But it's not like esoteric. There's no crystals or anything like that. It's really conventional techniques that you can do at home to eliminate your back pain. So in 1988, I jumped off a cliff into water. And when I jumped off the cliff, from the top of the cliff into the water, it was 85 feet. And we did this for fun because we thought it was a good idea. And when you go from 85 feet, by the time you hit the water, you're going 65 miles an hour. So it's kind of like a little car crash, like you're really going to hit the water fast. And when you land, you want to go in straight, absolutely as straight as you can, because, you're going pretty fast. But what I did is I landed my feet a little bit in front of me and I jammed my sacrum into my L5 vertebrae and I squashed the disc. And the problem is I was very young and very naive and I thought it would get better. And it did not get better. And I had tried some physical therapy and I tried a little bit of chiropractic. It didn't work. And then eventually I found a chiropractor that was doing some work on the disc. And disc-related problems are different than, say, sprain, strain, pull the muscle, things like that. There's different types of back pain, right? Disc is definitely more complicated. And he did some work, and I started feeling a little bit better. And my pain went from a 7 down to like a 4. And I thought, you know what? There's something to this. I don't know what's going on here, but I'm finally feeling better. So I decided at that point in time I would be a chiropractor. And this is 1990. And I still had pain. My pain was about a 4. It really never got better than a 4. But my efforts to going to chiropractic college were to eliminate my back pain and learn everything I can about back pain. So I went to chiropractic college and I graduated. And when I graduated, I started opening clinics in Chicago. And our clinics were, we call them center of excellence. It was a team-based approach. It was chiropractors, medical doctors, nurse practitioners, acupuncturists, massage therapists, nutritionists, all working together for the good of the patient, and we only treated back pain.
Which is the kind of practice many of us wish we were going to after we have recovered from this.
So we were really good at most, but the conditions that we weren't very good at were the disc-related conditions. And when I graduated, I had learned a lot, and I was feeling better, but my pain was still about a 2. So I'd gone from a 4 to a 2, and we were treating back pain. And again, it was pretty obvious right away that we were really good at the non-complicated. But when it came to the disc-related problems, those were a challenge. Bulging disc, herniated disc, degenerated disc, stenosis, all the things that sort of come with the degeneration. we were struggling with some of those, and we were doing a lot trying to fix it. And we weren't very good at it. So during this time between, say, 93 and 2005, my back pain had gone from a 2 to a 3 to a 4. Eventually it had gone all the way up to a 7 or an 8. Now, it wasn't a 7 or 8 every day, it was every day, but it wasn't all day. I might feel okay in the morning, and then as the day progressed, by the end of the day, the best I could do was go home and lay on the floor. And I had kids. I had all the normal things, right? I had a family, I had kids, I had a house, I had to cut my grass. I couldn't take care of the family. We went on vacation one time, and I was carrying the luggage and carrying the kids, and we went to Disney. By the time I got there, all I could do was lay in bed for a week.
Right.
And it's like torture, right? I mean, especially at Disney. So it was terrible. So my back pain was getting worse, and we weren't very good at my type of back problem.
So what did you try?
I had access to all the therapies. I had all the chiropractic, physical therapy, acupuncture, any medicine I wanted, you name it. I could have had it. Didn't help. It was just getting worse. So around 2005, we started looking at the disc saying, all right, what can we do to heal the disc? Because my disc had degenerated. See, the longer you have these things and you have pain, the thinner the disc gets. So, a normal healthy disc might look like this, and my disc started looking like this. It just was degenerated. And that's on our website. You can see that as well. But I wasn't getting better, and I was getting worse. So part of what we wanted to do in 2005 was, if we increase blood flow to the disc, can that facilitate any healing to the disc?
Which I didn't think was possible.
The general thought is discs are hard to heal for a couple of reasons, but one of the main reasons is because they're avascular. There is no blood supply. There's no vein or artery that runs through the disc. So it's very hard to get the oxygen and nutrients into the disc once the disc is damaged. You got a herniation, a bulge is damaged, right? You got a degeneration, it's damaged. You got to get healing in the disc. So our thought was, all right, maybe we can get more blood to flow and maybe something will happen. So in 2005, we did a study. And the study was, we did an MRI, a treatment, and then an MRI. And then we compared the MRIs to see if we could get any blood flow. And we were looking to see if we could get blood flow inside the disc. So we were looking at the MRI to say, what happened to the disc? And what we found was there was very specific exercises, stretches, and a way of taking pressure off the disc that got the blood to flow. So we saw that we could get some blood flow, but we didn't know what that meant. Does that mean people are going to get better? Is it going to heal the disc? We did it one day, one time. And we were working with a researcher out of Oregon State University. So, well, good news is something happened. He says, but you don't really know what that means. So he says, now what you have to do is you have to take 6 people and put them through a 6-month program to see if you keep increasing blood for 6 months, if that changes the disc, right? Does that change the health of the disc? So what we did is we had 6 people, 3 days a week, go through a program. And at the end of the program, it was 6 months. At the end of the program, we were going to do a third MRI. And on that third MRI, we were looking to see if we could increase blood flow. Again, we were looking inside the disc, and we were looking at the nucleus. We looked at the annulus, the outer portion, but we were also looking at the jelly on the inside. And what we found was we could get an 80% increase in blood flow inside the disc, but that wasn't the important part. What we saw was 2 of the 6, their herniations completely went away. Completely went away. Yeah, that's the same reaction we had. And the bulges were getting smaller, and the degeneration was starting to heal. You could see that there was fluid inside the nucleus, because a degenerated disc, there's no fluid in the nucleus. We see fluid, and we also saw that the outside of the annulus was getting a little bit thicker.
Yeah, degeneration you would consider like dried out, correct?
Well, it's a phase of drying, but okay. Yeah, the nucleus dries out.
Can you describe a disc for us?
The disc is like a jelly donut. Outside of the disc, there's a thick material called the annulus, and inside the disc, there's a jelly-like substance. And that jelly-like substance is in the center. It's like a jelly donut. And what happens is that jelly dries out, and as it dries out, what it does is it gets thinner, right? The disc physically gets thinner. And it's like the air in your car or your tire. When your tire runs out of air, the tire gets closer to the ground. Same thing. That degeneration is a drying out of the nucleus. And what we saw was we were able to get more blood to flow into the nucleus. So we were getting more fluid in the nucleus. So the herniations, 2 of them were gone, like completely. And the interesting thing about this is when we first did this study, I was talking with the radiologist. I'm like, because we had a medical doctor, he was reading all the MRIs. I said, here's what we're trying to do. We're trying to see if we can increase blood flow. He says, what? I said, yeah, we're looking to see if we could increase blood flow. He goes, that's the dumbest thing I ever heard. Well, this is what we're going to try to do. Do you want to read the MRI or not? He's like, I'll do it. So he did it. And the funny thing is, when we sent those 6 people back for the MRI, he called me. And he never calls me. I'm like, oh, what happened? Because I'm like, did something happen to the patient? I mean, what happened? He goes, no, come over here right now. Come over. And so I get over his office and he's got the MRIs up. And I said, what's going on? He says, look, what do you see? I said, I don't see anything. He said, that's the whole point. The herniations are gone. And for him, he even said, he goes, I thought that rehydration thing was stupid. I still think it's stupid, but he says, this is a big deal. This is a big deal. He'd been reading MRIs for 30 years. He said it never occurred to us that herniations could go away. So that was a paradigm shift. That was the beginning of, all right, maybe we could do something to heal the disc, right? For all the people that are stuck, right? It's the 20% of the people that ever have back pain never, ever get better because they got a bulging disc, herniated disc, degenerative disc, and traditional therapies aren't good at that. Most therapies are designed to decrease symptoms. They're symptom relief, right? It's kind of a quick fix. But in the end, you have to rehydrate the disc, reactivate the muscles. There's a whole process to it, but we slowly figured it out. But once that started, then we spent the next 5 years trying to figure this out. So we said, all right, discs can heal. What else can we do to heal the disc? So we started doing a lot of different things, and we sort of put this protocol into all our clinics. So now we're treating thousands of people. We sort of became the disc specialist. So we're getting all these people in the program, and we're learning a lot. We're confused. We're troubleshooting. We have a lot of meetings. And, even at our best, we were only getting about 45% success rate. But that was 45% of the people that had tried everything else and didn't get better. So that was progress. But when you have 55% really not getting better and not understanding why maybe they're not getting better, it's a challenge every day. Even though some people it's like a miracle, the other people it's like, just not getting better, right? So you're really working. We're having a lot of, I don't want to say it's a challenge, right? Because it's like, all right, we're trying to figure this out. And then not only did 55% not get better, but there was 3 to 4% that they would get a little bit worse. And they would get worse, not permanently, like it wasn't permanent damage, but it's like if you've ever had a flare up, and I knew you've had back pain, I don't know how long you had it, but there's always flare ups, right? There's good days and bad days, and you never really know why, right? So we were doing parts of the protocol, and certain people it would aggravate their condition. It's that squeezing of the disc, and the disc pops out, but we didn't know why. But we knew it was parts of the protocol, and we didn't know who. And the worst part about it was we could have 2 identical herniations. It'd be, 5 millimeter herniated right side, pinching the nerve, causing sciatica, 2 of them. Put them up. They both look exactly the same. Put them both in the program. One got better, one got worse. Couldn't figure it out.
What were your next steps?
So 2010, we started doing a study. And the study we did in 2010 was standing up. So in Chicago, there's 3 MRI machines that you can stand up inside of them. They have them all over the whole country, but we were fortunate there's 3 in Chicago. So we had people standing up, and when you stand up, there's more pressure on the disc. So maybe a simple little herniation may be real small, but then you stand up, it gets real big, right? So you can see bigger herniations, bigger bulges. But what we did is we had them stand up, and then we had them bend forward, backward, side to side, and rotate. And what we were looking at was the disc. What happens to the disc when people are bending? And what we found was certain positions people bend into, the herniations would get bigger, and certain positions people would bend into, the herniations would get smaller and even go back inside the spine. We'd never seen that. So that was the second thing. So the first thing is we saw that herniations can go away. Couldn't figure out why it didn't work on everybody. And then we found that there's these patterns of motion that make the herniation bigger, and then it feels worse, by the way, and makes it smaller, and you feel better. Like, I feel better, or my sciatica is gone. So we discovered there's 5 patterns of motion. Everybody has 2. Everybody has 2 that make them better. Everybody has 2 that make them worse, and it's not the same for everybody. So you might bend forward, you get worse. I bend forward, I get better, or vice versa, right? So we discovered these 5 patterns. It wasn't the same. That was our first flaw. We thought the biomechanics of the disc were the same for everybody, right? But they weren't. We didn't know that. So once we discovered this, we were also able to identify what position people had to be in to get that disc back to the inside. So we knew what position they had to do exercises in. Then we knew what position they had to take the pressure off the disc in. And it really created, it was like an aha, like, all right, that's why that was the missing link. It was like the Rosetta Stone. Like all of a sudden it all made sense. That's why some people are better with yoga. Some people are worse with yoga. That's why some people are better with Pilates or worse with it, swimming in a pool, you name it. It was why. It's why it's worse when you stand and you walk and you sit and you get on a bike. It helped us figure it out because that disc was moving around in there. And it depended what you're doing, what position that disc was in.
Yeah. It's like physical therapy. People will either love it or hate it. It's the same moves for everybody for the same diagnosis.
I only see the people that hate it, by the way, because they're like, I did it. It didn't make me better. It made me worse. Yeah. Right. Because they will give you exercises that make you worse because in their mind, it's one size fits all. Oh, you have a herniated disc, do this. You have a bulging disc, do this. Right. It doesn't work that way. Matter of fact, it doesn't matter what you call it. Only matters your pattern. Because once you know the pattern, then we know exactly what you have to do to fix it. So once we discovered these patterns, then what we were able to do is put together a step-by-step process. All right. We know what position you have to be in to get it back to the inside. So we developed a very specific stretch for that position. And then based on the pattern, what was causing the pattern was weak muscles, tight muscles, inhibited muscles, tight joints, right? And I think weak muscles, like I said that. But it's a combination of muscles not working the way they should and then joints getting tighter that create this what we call faulty pattern of motion. So once we know the faulty pattern of motion, we know what stretch you need, we know what exercises you need, and we know what the order is. And there's a right order and a wrong order. And even though everybody says squats are the best exercise for back pain, yeah, but if you have a hot disc, it's the worst exercise, right? There's a time when it's the best exercise, but if you do it at the wrong time, you're going to make it worse. And I see that all the time where people are like, oh, yeah, I had a herniated disc and I was getting these exercises the first week and one of them was squats. I'm like, oh, in physical therapy, right? Or where? Chiropractic, doesn't matter who does it. There's a right order and a wrong order, but we figured it out. So once we figured it out, it got to the point where patients could come in, we'd identify their pattern, and then we'd put them through the protocol based on their pattern. Do this, do this, do this, do this, do this. And they started getting better. And these are all the chronics. These are all the people that failed everything else. Matter of fact, the average person on our program has back pain for more than 7 years. And everyone has a disc-related problem. And by the time they get to us, they're still a 7, right? 7 or an 8. I think our average is about 7. So they've tried everything, didn't get better, and then they go through our program. And this is all done in the clinic. They go through the program and they get better. So once we discovered the patterns, our success rate went from 45% to 95%. And it didn't happen to figure out all the missing pieces, but once we figured them out, that's when we really were making sort of some ground, right? So in 2015, we did a study, and that was with Oregon State University, and one of the researchers that had done all the research for us. And what he did is he had 70 people with sciatica, herniated disc, bulging disc, degenerated disc go through our program, and 70 people with sciatica, same condition, herniated, bulging, degenerated, because that's what's ultimately pinching the nerve. It's the pinching of the nerve that exits, right? So they went through traditional physical therapy. So he compared our results to traditional physical therapy. And what he found was our program was 10 times better. And it was 10 times better because it addressed the underlying cause. When you eliminate the cause, pain goes away, doesn't come back. So this was then published in a medical journal in 2015. And as a result of it being published, people then all over the whole world would see this study and they would say, you know what, maybe there's hope. Because when you have back pain long enough, or for that matter, you've failed surgery, right? It doesn't matter. Right. It doesn't matter what you had. If you've had it long enough, you feel like you've tried everything, nothing's going to help you. And especially if you've tried surgery and it didn't help. Then you're like, now you got nothing. Then you got nothing. So people would see this study, and when you have back pain long enough, the hopelessness leads to like depression, right? Like my life is never going to be the same. Right. So people would then see this study and they would call us. They'd be sort of full of hope again. Like, oh my God, maybe there's something different. Like they call us. They're like, I don't know what you guys are doing over there, but I'm coming in. Like, how are you getting here? Like, we're going to fly. All right. So people would fly in and then they would stay in a hotel and then they would go through the program slowly, 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 slowly. Now, the problem is when you're healing a disc, it doesn't happen in a month. It happens in 2 months to 3 months, right? It takes time. And that was us being aggressive. We had, the fast track. Like, all right, if you come in 5 days a week for 2 months, that could be enough, right? So people would stay in a hotel and do the program. And some people were pretty well acclimated. They came in, they were doing work in the hotel room. They could still do their job, or they had their families with them. And, they had a support group and everything was okay. But other people came by themselves. And they came to Chicago, and for 8 months out of the year, Chicago weather is not very good.
Yeah.
Right? Like maybe the same where you live, I don't know, but Chicago weather is really pretty bad. So they would fly thinking that, oh, I'm going to go see this beautiful city. I'm going to walk around and see all these beautiful buildings. Well, it was too cold to leave the hotel.
Right.
It was too cold. Right. And they're like, oh, it's too cold. Like, yeah, it's cold here. This is Chicago. So they would sit around their hotel room. You know, they would go to therapy during the day, and then at night they would go back to the hotel room, or they'd be by themselves. Right. And it's too cold outside, and their family's far away. And after a while, they were spending too much time staring at the walls.
That sounds pretty lonely for an already depressing time.
People started having like panic attacks. They were getting
it.
better, but there were too much time alone. Like there was just, and we weren't open on the weekends, so they didn't have anything to do on the weekends. I mean, there's so much TV you can watch before you just had enough. So people were having panic attacks. I was getting phone calls. I got a phone call from a guy one time at 2 a.m. having a panic attack in a hotel room. You can't say, look, sorry to hear about that. I'll talk to you tomorrow. Like you got to deal with this, right? These are like heavy emotions. These aren't like simple emotions. So I'm like, all right, we'll help you out. So I was spending a lot of time managing the emotions of the people stuck in the hotel room. And I thought, man, this is too much. It was really going to be too much. I said, either we're not going to do this anymore, or we're going to find a way to get them better faster. So what we decided was, since we could figure out their pattern, it wasn't that hard to figure out. I said, why don't we just send them the exercise ahead of time? All the introductory exercises, you know, it's like that way they could get stronger before they got here. We know what they have to do. We'll just show them what to do and have them do it. So we showed them what they had to do, and they were doing it. And then after 2 months, they'd fly to Chicago, and when they came in, they were feeling a little better. They had a little more hope. They were in a better mood, and we could get them to the program in a month, right? So they could see there was light at the end of the tunnel. So they were a little happier, right? A little less stressed out. But 2 months in a hotel room staring at the wall will drive anybody. It's like being in jail, right? It just drives you crazy. So people were feeling better. And then finally there was a guy in Australia, and he had tried everything. 10 years of back pain, tried everything, hurt to walk, hurt to sit, hurt to stand, hurt to lay down, everything hurt. Couldn't surf. He was a surfer, couldn't surf, couldn't do any of that. And he's like, I don't know what you guys are doing, but I'm coming. So we said, hold on. We're going to send you exercise. You're going to do these every day for 8 weeks, and then you can fly. That way you can, you know, be a little stronger. He's like, all right, I'll do it. So he did all the exercises every day for 10 weeks. And then he called us. He's like, look, this is the best I felt in 10 years. He's like, I can stand without pain. I could walk without pain. I could lay down without pain. I couldn't do any of that. He said, this is absolutely the best I felt. He said, the problem is I can't sit. If I sit for an hour, my pain's a 7 or an 8. He says, but I can manage my life without sitting because I have a stand-up desk. I eat. I can sit down for a couple minutes and eat and stand up. I stand up a lot, or I lay down a lot. He says, I don't have to sit. He said, my problem is I'm scheduled to fly to Chicago, and it's 24 hours on an airplane, and I'm going to be seated for at least 20. He's like, you know, I'm not coming.
What do I do?
Yeah. He's either you're going to have to come carry me off the airplane, or I'm not coming. I'm like, well, we're not going to carry you off the airplane. He goes, I don't really want to come anyway. He's like, I don't want to have to go back to the pain I was in. He says, I'm feeling so good. And he says, I'm afraid that, you know, after a month or 6 weeks, whatever your program, I'm going to fly back home and I'm going to be in the chair again. He's like, is there any way I can do this at home? And at the time, we were still using a lot of equipment. Pressure off the disc and exercise and all kinds of things. I said, I don't know. I said, we've never done that. I don't even know if it'll work. I said, we'll have to modify the protocol. I said, but you know what? I'm willing to give it a try. So we modified the protocol. He did all the exercises, and by the end, his pain was gone. It took a long time. It didn't happen overnight, but we worked with him, and we modified so he could do everything. No more pain sitting. And he was a surfer. He could surf again, living his life, right? Stays active, stays fit, keeps the muscle strong, no pain. So that was the first one that got better, you know, serious back problems. And when I say serious, you have a serious back problem. If you've seen 6 doctors and you didn't get better, you went to Mayo Clinic or Cleveland Clinic or wherever it is you went, in Texas Spine Institute, you didn't get better. That's a serious back problem, right? Because then nobody can help you. So that was the first time anybody ever got better. And the only time we ever saw him was something like this, where we're doing video. We never saw him in person, right? Didn't put our hands on him, didn't do anything. So that was the first one. So I said, you know what? Maybe we could do this. Maybe they don't have to fly to Chicago. So I said, let's get 10 more people. And then what we'll do is same thing. But I don't want 10 people with the same pattern because that was a mistake we made in 2005, right? We thought it was going to work on everybody. I said, I want different patterns. And I don't want to put this out on the internet if it's not going to work, because that's just a bigger headache, right? For me, I don't want that headache. I don't need it. So we had 10 more people go through the program. They did all the work. We modified the protocol. They got better. Chronic back pain, herniated, bulging, degenerated disc, got better, never came to the clinic. And all we ever did was a couple of video conferences like this. Couldn't believe it.
At home. Was it just back pain?
Specifically designed to address underlying cause, faulty motion, lack of blood flow, and compressive load. You fix those three things, pain goes away, doesn't come back. It's specific for herniated disc, bulging disc, degenerated disc, stenosis, post-surgery. Doesn't matter. Doesn't matter. So that's what we have. We have an online program now specifically designed to address the underlying cause. And, you know, we've been treating back pain for 30 years, and we've been doing the online since 2017, and it works. And it works really well. As a matter of fact, it works so well, we guarantee it. So if we accept somebody into our program and they don't get better, we give them all their money back.
Oh, wow.
Yeah. And the only reason we can do that is because we know exactly what you have to do. And all our systems are designed to make sure you do the work every day. We know what you have to do. And we've done it thousands of times.
Is there a patient story you could share?
So we had the study that was done in 2015, and then we had another one that was done in 2017, maybe, I don't know what year it was, somewhere around there. And it was a woman, she had fallen down on the ice. And she fell down the ice when she was 15. This is in Chicago. And she herniated the disc in her back. So this is when she was 15. She herniated the disc, which is kind of rare for a 15-year-old, but it does happen, right? I mean, I certainly see a lot of 15-year-olds. But for her, at the time, she got some chiropractic and she felt a little bit better. And then the pain came back, and then she got some chiropractic and physical therapy, and then she felt a little bit better. But every year her pain would come back. And every year it came back, it got a little bit worse, because what's happening is you're getting weaker. The disc is getting weaker and the muscles are getting weaker. So now when it gets injured, it takes that much longer to get better. And then finally what happened, 30 years. So she fell when she was 15, every year for 30 years till she was 45. This pain would come and go every year, worse, took longer to get better. Finally turned 45. She said her back went out. She did something to aggravate it, and it never got better. And all the treatments that she had tried, chiropractic, physical therapy, acupuncture, injections, opioids, all the things that have worked in the past stopped working. And so everybody, her husband, her family's like, you have to get surgery. Like, you have to get the surgery. So even the chiropractor, everybody she worked with said, yeah, we can't help you. Like, you're not getting better. We don't know what to do. So she went to the surgeon. Surgeon convinced her to get fusion. She got fusion. And her pain went from I think it was a 7 down to a 4, which is better, right? And then 2 weeks later, it went to an 8. And it was at an 8 every day for 2 years. And it went from an 8 to a 9 to a 10, 8 to a 9 to a 10. And the only thing that would take the edge off was opioids. And I think at the time, you're only allowed to take 5 a day. She was taking 15 because the pain. I
can't imagine her depression.
So she was depressed, clinically depressed, right? I mean, she was seeing a, therapist, psychiatrist, everything. And during that time, she tried to kill herself 3 times from the pain. I
believe it.
3 times. And finally, interestingly enough, she's like, she was praying to God. And she said, God, give me a sign. If you want me to live, give me a sign. And then she saw something about our program, and she figured that was the sign. I mean, maybe it was, I don't know. But then, so she saw that, and then she made a call. We put her on the program, took her about a year and a half, about a year and a half, pain gone.
That's amazing, because you'd think with all that hardware in that.
Yes. Pain back to a 0. And that's been it's probably been 8 years. I don't know how many years it's been, but even 5 years after the original injury and treatment, they followed up with her, and she still was out of pain. And to this day, she's still out of pain, because I follow her on Facebook. And the other day she was she was posting a picture of her doing a deadlift, and she's in her mid 50s. I'm like, oh, her name's Carmelita. I'm like, Carmelita, I don't think that's a good idea. She goes, don't worry about it. I got this. I know what I'm doing. Okay.
So I have a Reddit community for microdiscectomy for people considering or recovering from surgery.
Yes.
And I'm surprised at the reherniations. People will reherniate pretty quickly, and some even reherniate a third time. So, I don't know what I'm talking about, but to me, that feels like there's a stability issue or something.
I tell you what, traditional therapies don't address the cause.
Mm-hmm.
So if there's limits to how much load and motion a disc can tolerate. And if you never eliminate the faulty motion, you always re-herniate it because you're doing the things that caused it the first time, but you're doing it and you don't even know you're doing it. And nobody's ever told you you're doing it. Right. In fact, one of the things that people love the most is we have it's, we call it the top 10 tips. It's 10 things that you do every day that aggravate your disc and you don't know you're doing it. It's how you sit in a chair, and probably everybody knows that one. It's how you sit on a toilet. It's how you get out of a chair. It's how you get off the toilet. It's how you get out of your car. It's how you get out of bed. It's how you sleep in bed. It's how you take dishes out of the dishwasher. All the things that you might do that aggravate it, there's a right way and a wrong way. And if you do it the wrong way, part of it is because the muscles you need to do it the right way don't exist because they've gotten weaker, or it's just a habit. Just a habit you've had it your whole life. You think, I've always done it this way. Well, okay, maybe it was always wrong, and now you got to fix that. That is why herniations always come back. And that is why even people that had surgery can get better on my program, including the woman that had the fusion.
Right.
Because now with hers, like when you have a fusion, very often what they do is they put metal rods and screws in, let's just say L4, L5. They're going to fuse these two right here. They'll do it in the back, but it's easier to see it in the front. They'll put rods and screws in there. And what that does is it prevents any motion to that joint. Well, let's just say that joint had too much motion because that was the one you were using to bend. Then what happens is now you start to bend with this one or the one below. They call it above below syndrome. What happens is those discs break down. And if you're more active, they say within 3 years, you're going to need another fusion.
Oh, wow.
Yeah. And that's like, you couldn't have anything more invasive than a fusion.
Mm-hmm.
But what we do is we eliminate that motion. We activate and you get the blood flowing back to the inside. Pain goes away. It doesn't come back. Because what people do, the biggest problem people have is they bend using their spine. Like if you've had back pain long enough, or if you sit for too long, the glutes, which are the muscles in the back, become inhibited. And when the glutes are inhibited, then it's like a light. Like you could turn the light switch down so the lights aren't so bright. Nervous system slows down the information being sent to the muscle. It's called inhibition. So it's not muscle weakness. It's the nerves aren't telling the muscles what to do, or they're telling them what to do, but they're not telling them at high enough volume, right? We need more volume. So part of what happens is when you sit for too long, glutes become inhibited. Well, when your glutes are inhibited, then you start to use your spine to bend instead of your glutes because the muscles really aren't there. The body's like, well, I don't want to use that muscle. It's not working. I want to use this muscle. And then all that constant bending on the disc causes the disc to break down. When you use your spine to bend, that's when the disc breaks down. So part of what we have to do is retrain those muscles. And that's part of the program. So it's a year. We have a year-long program, but it's specifically designed to eliminate the underlying cause, which is the faulty motion, also increase the blood to flow to the disc and get the nucleus back to the inside, which then frees up the sciatic nerve. Like at least half the people on my program have sciatica, and they've tried every possible treatment, didn't get better, and they go through my program and they get better, and they never even come to the clinic. They can do it all at home. It's how to take the pressure off the disc to get the disc back to the inside and then reactivating the muscles. That's the key.
And does your program also include nutritional guidance? How important do you think nutrition is to healing?
Interesting. Because we track this. Like if you start my program, and not too many people do this. Matter of fact, we started doing this probably like 2012 in the clinics, and it was dramatic. It was dramatic because when you see a patient every day, and I don't know if you've been to chiropractors or physical therapists, how you doing? Oh, I'm feeling a little bit better. Or, I'm okay. So a lot of times the patient doesn't want to tell you they're not getting better, or because they don't want to hurt your feelings or whatever, because you're really working hard, right? So until we started tracking it, we thought, oh, Bob's getting better and Joanne, she's getting better. And once we started tracking, it's like, wait a minute, they're not getting better. Because you might write notes, oh, patient came in, less pain, whatever it is. But when we really started putting the numbers on paper, it was like, wait a minute, we thought they were getting better. How come they're not getting better? And we talked to them like, oh, we didn't want to hurt your feelings. So, but my point is, we track everybody in the program. So when you start the program, we know your pain level, we know your disability level. We track what's called Oswestry Disability Index. It's the gold standard for tracking disability as a result of back pain, but we use it as a gauge. Are you getting better? Is your pain getting better? So we track everybody, and we know what you should expect. This goes back to our guarantee. We know you're getting better, and if you're not getting better, we have like an intervention, like because you're either doing too much or not enough. But my point is, we track all this, and one of the things we track is the overall effect of food on your body, and it's through a questionnaire for what we call leaky gut. I don't know if you ever heard of that, but leaky gut is where your intestines maybe aren't digesting the food the way it should, and then you're getting undigested food into your bloodstream along with some particles of bacteria and viruses, and it creates this sort of inflammatory process. The people that get better the quickest have the lowest score, and the people get better the slowest have the highest score. Meaning diet is, for the people that aren't getting better, tends to be one of the most important things. Like they're all doing the right work, but they got a terrible diet, or they've got such a bad leaky gut that we have to balance that out, and then they start getting better. So for us, if you had asked me 3 years ago, how important is it? I'd say it's kind of important. But I know now that there are certain people on our program, and we if we weren't tracking it, we wouldn't have known. We would just said, oh, she's not doing the exercise, or Bob's not, he's not participating, whatever it was. But he really was doing the work, but his food was way out of balance, right? So once we started balancing the food out, they started getting better. So some people, because I've done videos, and like there was one on pumpkin seeds. I don't know if you saw it, but on Instagram, it had 20 million views. Pumpkin seeds. It was a 30-second video about pumpkin seeds. The pumpkin seeds are really good for you, right? Because they're really high in magnesium. They have a lot of good fiber, heals the intestines, right? So it's kind of the thing, but 20 million. And there was like, I'm eating the pumpkin seeds, I'm not getting better. I'm like, all right, you're going to get better, but there's exercises that you really need, right? So like you can't just eat blueberries and pumpkin seeds and drink green tea and coffee, because coffee brings down inflammation, and expect, a massive herniated disc, that's pushing way out, and then you're bending all day long, aggravating it. All right, there's only so much that you can do by decreasing inflammation. But when you do everything right, food is very, very important.
Yes. So it sounds like when I was recovering, I fed my emotions with Dairy Queen. That probably wasn't a good idea.
Well, as long as you got better, right? Well, you know what?
Emotionally.
There's a point where happiness is important too, by the way, because when you're happy, you have less inflammation. I don't know if you know that or not, but that's true. So if you're happy, you can actually improve, right? So, but I always say my program's like a lifestyle, right? It's the exercises, it's the stretches, it's the decompression, it's the movement patterns, it's the food, it's drinking the water, it's walking. When you have back pain and you're in prison and you want to get out, it's a lifestyle to get out, right? There's no quick fix. And the reason people get stuck is because they have this mentality, it's a quick fix, and it's not their fault. It comes from the therapist, comes from the doctors, comes from insurance companies. Insurance companies, they say, oh, herniated disc, 12 treatments. 12 treatments. You're probably going to make it worse because you're trying to get them better too fast, right?
Right.
Or you're not doing anything that encourages them to do the right thing. Right. I've always had a big problem with that.
So if I have a listener who has a failed back surgery or a bulging disc and they want to get better, where do they go to find your program?
highperformancespine.com is our website. And if you go there, we have before and after MRIs of people who went through the program, because we do MRIs, not on everybody. We've done MRIs at the end. And then my MRIs on there, so you can see my degenerated disc. And we have people that went through the program. And every person on my program, because like you said, you saw me on TikTok or Instagram or YouTube. I don't know where they see us, but I always say you don't call the TikTok doctor first, right? You're calling him last. And you might not call him, till you're so desperate you don't know what to do anymore. Like, I'll call that guy. That's who I get, by the way. But what that means is everybody that is on my program has had back pain for a long time and tried everything before they finally call me, right? So my point is, the people you see on there in the case studies are people just like you. What we do is we help people that have not helped anywhere else.
Right.
Meaning, if you've and that we pride ourselves on that, like, you know, and we guarantee it that, you know, if you have a herniated disc and you've tried everything and you get better, we can help you.
I'm sure it's very rewarding.
I love it. I love it. And I'm the underdog, right? Everybody's rooting against me, but we're going to win.
It's sorry to say that people are benefiting from your personal injury story, but
you know, it's funny because for 15 years it was a curse.
Yeah.
And then I got better and it was a blessing. And now I get to share it with the world because it has value now because, first of all, we give, like, if you go to TikTok or Instagram, there's a lot of tips, like what food to eat and what exercises not to do. They're making you worse. Because I'll share this real quick. So when you have a herniated disc, what do we know? We know that a lot of motion makes that disc worse, right? So one of the exercises they give everybody, there's two. The two of the worst ones: double knee to chest. Lay on your back, pull your knees to your chest. Well, what you're doing, you're squeezing that disc so hard it's coming back out. I go, oh, it hurts. No, you're not doing it right. Keep doing it. That's number one. Or the second one is they have you lay on your back, and then they have your knees up, and then they have you go side to side with your legs like that. That rotates the disc. Herniated discs don't like rotation. So those are two you shouldn't do. You shouldn't do. And so our TikTok and Instagram has tips of things you can do, but also our website, we were talking about that. There's videos of people who went through the program. Just watch their stories. And I promise you their stories are just like everybody. I mean, everybody that has back pain that's not getting better, those are the stories. Tried everything, didn't know what to do. Doctor didn't know what to do. Doctor said it was in my head. Doctor said I wasn't trying hard enough. We had one woman, she had a herniated disc, L5S1. They told her she had piriformis syndrome. Piriformis, there's a muscle in the back that can squeeze the sciatic nerve. Right. They say maybe 3% of all sciatica is piriformis syndrome. It's very rare, and it's the easiest one to fix because it's really not a structural problem. It's just a tight muscle, right? So usually a couple stretches, reactivate glute medius, that goes away. But everybody says, oh, I have piriformis syndrome. So they had this poor woman stretching her piriformis. Well, piriformis, you have to cross your leg and you pull your legs up, right? Because you're trying to stretch that piriformis. Well, what is she doing? She's doing this. She's doing this. And she did that for 3 years. 3 years. By the end, she couldn't get out of bed. They said, you're not doing it enough. She says, I do it all day long. I can't get out of bed. So we had her stop doing that. She started following some of the tips and did some of the stretches within a month. Like her pain was almost gone. That's kind of rare. That's kind of rare. But my point is they were giving her the wrong stretch. And that's not uncommon. They try to make it one size fits all.
Right. Which it's not. Dr. Jeff, I really appreciate you putting some time aside to be on the podcast. I'm sure the people are listening are going to really appreciate your information. And just for one more time, say your website for them.
highperformancespine.com. Maybe not the greatest name, but it works.
It works.
Well, and I am here to give people hope because sometimes they run out of hope. Yep. They've tried everything, didn't get better, don't know what to do. Call us. You qualify, we'll put you in the program. You don't get better, we'll give you your money back. But I tell you what, everybody gets better.
Yep. And that's why I have my podcast to give people hope. And that's why I wanted to have you on the show.
That's awesome. That's awesome. I appreciate you having me on your show. Bed, back, and beyond. Right?
Yes, that's right. Bed, back. That's my husband's idea. He named it.
Empowered living. I love it. Yeah. I love it.
If you are a listener with a positive story of recovery and you would like to share your story on my show, head to bedbackbeyond.com and click share your story. Once again, Dr. Jeff, it was a pleasure meeting you.